The challenge with this surgery, of course, is that it's almost a gigantomastia, meaning it's really an extremely large, excessively heavy breast. You'll be given a general anesthetic for the procedure. We'll start with a small access point, which we'll place in a vein in your arm. Then you'll receive the appropriate medications, which will make you feel like you're falling asleep at first, but you'll actually be a bit deeper under. That means you won't be aware of your surroundings at that point. You won't feel any pain and you'll be well relaxed.
Yes.
We'll be there with you the whole time and you'll be closely monitored.
Ah, great.
Yes?
Yes.
And then we'll get started right away after you've spoken with the surgeon. That is me and Dr. Schumacher.
Great.
My hands are a bit cold, yes. It's really tough for you too, isn't it? That's a lot of weight, actually. So here I'll rotate the breast upward. It needs to be straightened out a bit. The breast is a bit larger. That's it for the drawing. Then you can go ahead and change into your little surgical gown. And the challenge with this surgery, of course, is that it's a very, very oversized, overly heavy breast with significantly sagging nipple areola complexes, as we call them. So the nipple and areola complex has really sagged far downward in this patient. We have to bring that back up using what's called a pedicled flap technique. We're trying to perform the whole procedure as gently as possible. I'd say I'll go ahead and make the incision, and then we'll get started. We're about to remove a C-shaped segment of breast tissue here. That's the characteristic feature of the whole Findlay method. And we're going to remove it in one piece, then weigh it, see where we stand, and after that we'll do some fine-tuning. This is actually a pretty bloodless procedure. That's simply because we've programmed our radiofrequency devices here in such a way that we can make incisions with very little bleeding. That's why we can usually do without drains in most operations. Here we might place drains for a few hours, but generally I'd say in 99% of patients we don't need them. Now about an hour has passed and the first breast has already been reduced. We've probably removed around 600 grams in total. The breast will now be reshaped using these so-called pillar sutures, but we'll only do that after we've treated the other side as well, so that we can achieve the best possible symmetry. That looks good. A size 0 suture. Now, using so-called pillar sutures, we are reshaping the mammary gland and essentially stabilizing it from the inside. So we are not dependent on the skin, as is the case with many older methods where a wedge-shaped part of the lower breast is simply removed. Then the skin is stitched together, and the skin is supposed to hold everything in place. Of course, that doesn't work. Okay. Here you can see again, the charming thing about this Hall-Findlay method is that the breast gets a beautiful projection, and it almost looks as if I had a small implant in there. But that's just the reshaping of the mammary gland with this elegant technique from the lovely Elizabeth Roy Findlay from Canada. Sending greetings out for sure. Many thanks for that, for this innovative, beautiful method, which, by the way, we've been using for about 15 years. So it's not exactly new for us, so that's it. In total, we've removed over 1 kilogram of breast gland tissue. I hope this will bring the patient significant relief. In any case, she doesn't have to stay with us today, but can be discharged without drains. And with that, I'll wrap things up for now. The patient will now be taken care of a bit more, get a bandage, and then go to her room for the time being. Okay.